Maternal mental health is declining. There are fewer moms out there saying they are in excellent physical or mental health, and providers are not entirely sure why this is happening.
Our mental health expert, Dr. Cheryl Ziedler, joins us this afternoon with a closer look. And can you start a little bit by telling us what this new study found? What did they examine and what did they learn?
So this is a JAMA study that did sort of a retrospective. So they were looking over the years from, I think, 2016 to 2023 and looking to see what the differences were. And what they're seeing is that the numbers are going down with moms who are saying, yes, I'm in excellent mental health. And so then I was wondering, okay, well, maybe 2024 and maybe even the beginning of 2025, maybe things have gotten better. Maybe that's like so COVID specific, but in fact, it's not. So it's still continuing to actually go down. Just even in the last year and a half, Science Journal did another study. And so we're really seeing this trending this way. So it can't just be COVID. It's not just a one-off. We're talking probably now a solid decade of research showing this decline.
What do you, when you say not excellent mental health, I don't know that I've ever been able to say I'm in excellent mental health as a mom. What does that look like?
It's a hard job.
Seriously. So
Yeah.
what does the declining, are there specifics that you can point to?
Yeah, so they just listed their stressors, right? So it's funny because in 2016, when they started studying this, is when I wrote Mommy Burnout. So I wrote a book about the chronic stress on women because I was seeing that trend myself. And so the things that they're reporting, I mean, there's different groups, that's number one. So the hardest hit group are gonna be single moms. So single moms feel like they don't have enough support, they are really stressed by finances, and so they're lonely too. And the loneliness piece is the thread no matter what the group. And so just feeling, there's a difference between like, do I have people to support me, right? And then do I have connections, people that I can talk to? And that's what, not just among moms, but among many groups in adults and teens, that's what we're seeing is this loneliness and lack of social connection seems to be one of the strongest variables in this.
I can imagine that support systems, like you just mentioned, are a big part of this. Do you have family to help take care of your child? Or do you have family or friends that can help step in if you need to go to work one day or something like that? I can imagine that that has a big impact on mental health when you're looking at which groups are impacted the most.
Absolutely. So when we look at this, people are moving around more. They have job opportunities, educational opportunities. So no longer is the family unit necessarily raising their family right alongside, two sides of extended family.
Right.
And so when something happens, if everything doesn't go just accordingly, or a caregiver calls you out and says, I can't come watch your kids today, you have more and more women who are saying, A, not only I don't have a backup plan, but B, I also don't feel like I can take off because I need this money. And so we look systemically at the systems in place to support mothers and families in general, and that's where we're really lagging behind. Sometimes when we compare ourselves to the whole world, we have some pretty poor, what they consider sort of family systems type support.
How does this affect our children? Because there are moments like in the moment I can feel it. I'm like, I'm not at my best right now. How is this affecting my little girls?
Yes, I know. So that's one of the things that this study also looked at. So one of the findings is, of course, we're worried about these mothers, but this trickles down to your kids. We all know what that feels like. When you're tired, you're in a bad mood, you're stressed out about things, you are more irritable, you are less patient with your kid. And so when we look at the long-term studies, even starting in utero, this isn't a part of this study, but we've talked about it here before, women who are really stressed when they have a baby in utero, we actually see long-term outcomes for those kids. They hold on to those stress hormones. Their brains are rewired a little bit differently. They have higher levels of cortisol. And so it's very interesting. It's not just like, oh, that's too bad, but it actually then it is a generational thing, goes down to their kids and can get passed on. So it's something that really is sort of a public issue. Everybody should care about this issue.
So before we let you go, one final question. What can people do to help? Friends, communities, partners, support systems. What can people who are in a place to help, in a position to help, what can they do to step in and say, hey, let me take this one?
Yeah, interestingly in the study, they actually flat out said, like, when you ask somebody how they're doing, make it meaningful. So not just like, oh, how you doing? Everything going good? We do that and we're sort of keep walking, but really like, how are you really doing? Asking people meaningful ways on how they are doing and then what you can do to be supportive. And so there's different times too when moms are busy and you think, I'm not gonna ask you, you're busy too. But we have to trust each other that maybe I've got a little bit more bandwidth this week. And so I am asking saying, and I mean it. So that's one of the things. And also we've got to look at policies. We've got to look at just how can we support families better in the workplace, and particularly women and single women. Those are our most at-risk groups. And so what can we do in terms of support and also connection, social connection, that they can get those needs met because they're very real.
Very real.
Such an important conversation, Dr. Cheryl Ziegler. Thank you,
Thank
as
you.
always.
Appreciate it.